I'm going to talk to you about the art of treating depression. And the first thing about treatment is making the diagnosis and getting the patient to accept the diagnosis. Like a lot of people come in with fatigue or headaches or chest pain, and they're worried about heart attacks and brain tumors. So you have to rule that out first, and then when you can say to them, everything looks good, how are you feeling, mood-wise? And then you go through the 9 steps for depression. And number 1 is fatigue. Number 2 is sleep disturbances. They're waking up at 3 in the morning, trouble getting to sleep, trouble staying asleep, crying, blaming themselves, and lack of joy, lack of concentration. Their weight is either going up or their weight is going down. They're faster or slower than other people. With an agitated depression, you'll be faster, and suicidal. If they're suicidal, that's an emergency. You have to deal with it right then and there. Don't move on. If they're not suicidal, then you start looking at treatment. And the hardest part about treatment is to getting the patient to accept the treatment. So number 1's diet. Lots of omega-3 fatty acids and fish, getting rid of junk food, avoiding caffeine, avoiding nicotine, avoiding alcohol, slowly tapering off all of those 3 poisons, and then exercise. And a lot of people, when they're depressed, they can't even get out of bed. So you have to really slowly get them to exercise, just walking around the apartment, going up and down stairs. A week of going out and walking around the block, and then the next week it's twice around the block, and the next week 3 times around the block, just slowly building up that exercise tolerance. And then counseling. And that's also a hard sell with patients. They don't want to go to a psychiatrist, they don't want to go to a psychologist or a social worker or a counselor. So I always say to them, if you had a heart attack, you would go to a cardiologist. If you're having trouble with your mood, you're going to need to see a specialist for that. There's no harm or shame in doing that. And your brain got you into this, so your brain can get you out of it. And then last but not least is medications, and that's once again a really tough, hard sell because people Google them on the internet. There's a list of 100 side effects, and I always say, let's Google aspirin, and it's 3 pages of side effects. So every single drug in the world, including Tylenol, has side effects, and you have to sort of balance the good with the bad. And then I tell them, antidepressants are not addicting, and they're going to take a month to work. So I bring the patient back week after week, and we slowly get them to that month level. And if it hasn't worked in a month, then we double it at that stage. And I warn them about side effects so they don't catch them unawares. I'll say, you're going to feel nauseated, you're going to feel spacey and drugged out. You're going to be sleepy on it. You might have diarrhea and vomiting. That's normal. It means the drug is working. That's going to get better. So, stick with it. Don't just quit it, because they want to quit it. They want it to fail. And don't stop your drug. So and I try not to make them feel bad about it. I said, if you feel like stopping it, call my secretary, let us know. We're not going to judge you. We're not going to be mad at you. We just need to be part of the picture. And if it's just 1 episode, they can go off it in the summertime. If it's 2 episodes, I usually say try to stay on it till you die happy at the age of 100.